The Eastern Cape Health Department has the highest medico-legal claims in the country of over 3 billion rand annually. It says most of these claims relate to maternity units. The revamping of this ward is believed to be a step towards reducing and curbing these cases.
This ward is going to assist us in dealing with the reduction of the medico-legals, because when we look at it, do an analysis, we picked up most of our medico-legal come from the maternity side. So that is why we have developed this. This is a high care for that matter. It's servicing the whole of OR Tambo, only 8 beds, but it's a high care. Those who are critically ill are referred to this hospital.
Gender Equality's investigation into the state of neonatal and maternal health care in public hospitals in the Eastern Cape found an increase in neonatal and maternal deaths at the province's hospitals. It says many factors contributed to the higher mortality rate.
Eastern Cape. Our findings is that there were infrastructural issues, there were also administration issues and governance issues with regards to how the hospitals are run, which in turn affected the rates of maternal and neonatal healthcare in the Eastern Cape. There were high rates of maternal deaths, there were high rates of neonatal care. The hospitals blamed it on the infrastructure, they blamed it on lack of resources, they blamed it on the lack of staff. So it's just a combination of issues that contributed to the stats that we're examining.
The department says it's working around the clock to address the issue.
There were reports and find out that there is an increase in the child mortality, but in where we are, there's reduction, which we commend the hospital for doing that, because remember, you can say it's reduced in other areas only to find that they are referring to Nelson Mandela, and you get Nelson Mandela now is getting high numbers. So we are happy that they are able to reduce. It means when they are reduced in Nelson Mandela, it cuts across in other hospitals because they refer to Nelson Mandela. So we really appreciate, but we are doing everything in our power to deal with child mortality.
I'm extremely excited with the investment that has been made by the government in terms of improving the infrastructure where we are actually working for our people in the country. And also, I think it's an excitement even for e-health professionals to be working in an environment that is conducive. And even for our patients, the patient care is our key, of which the patient, when it comes to a lovely environment like this, at least it will have that trust that I'm going to come out of the bed being alive.
The department says it's also improving infrastructure at its rural healthcare facilities to ensure the delivery of quality healthcare to communities. Fundiswa Mhlekude, SABC News, Mthatha.